Hi, my name is Michelle. I'm 71 years old and I direct a children's mental health clinic. 30 days ago, Dr. Gupta operated on me performing a partial nephrectomy using a robotic procedure, and I'm doing great. My tumor was discovered accidentally during a CT scan for something completely different, so it came as a surprise. But I wanted a consultation to help me figure out my options. I researched Dr. Gupta ahead of time and found through US News and World Report doctor ratings that he had a 5-star rating with more than 120 reviews, and that he operated at Cedars-Sinai, one of the top hospitals in the country. So I went to the consultation already confident in his qualifications. But I had something else going on for me. I'm a psychologist and I know anxiety when I see it, and I was anxious. My family has had a lot of cancer, and I've very sadly lost my dad and my grandfather to post-surgical complications from conventional surgeries. So I was needing something, I needed to feel confident. And what I loved about meeting with Dr. Gupta was that he really took time to understand my concerns. At a time when so many doctors seem rushed and overwhelmed and like they don't have time to really talk with you, he listened. He discussed my anxieties, and he showed me the CT scan. He talked with me about if he did the procedure, what he would do, how he would do it, and why. And he gave me information at a level that I could understand to help me make decisions. I'm grateful for that. I made the decision to have him monitor the tumor for a while I got my blood pressure to a healthier level and I lost some weight so that I would increase the possibility of having a good surgical outcome. My care at Cedars from start to finish was excellent. There are a bunch of teams that all work together: pre-op, anesthesiology, post-op, the nursing care on the floor, Dr. Gupta and his residents. Every team seemed like they knew exactly what they were doing, and at the same time, they treated me with kindness and with a human touch. An example would be I was cold in pre-op and they brought me a warm blanket. Just the little things that made me feel more comfortable. The good news for me is I was in the hospital a very short time, one night only, 1.5 days basically, and I didn't have a single one of the surgical complications that I was concerned about. The tumor was small. Dr. Gupta was able to get a clean margin. I had very little pain. The most it ever was a 3 out of a scale of 10. And I was able to go home quickly and resume my life. I started walking the day after surgery. I'm now walking 30 days later. I'm walking more than a mile a day. I've been working 3 to 4 hours a day remotely, and I go back to work full-time next week. The thing that I think impresses me the most, besides the obvious, clinical skill and expertise, the surgical expertise, is that Dr. Gupta has both. He has the surgical skill and the wonderful manner of treating you with respect, kindness, warmth, and taking time. He's fully engaged. He's there, interested in you and in what the plan is going to be for you. His office staff have been great, responsive with everything I've needed. So if you're facing a decision about surgery, anything urological, even if it's something more complicated than my situation, I would encourage you to consult with Dr. Gupta and to consider him as your surgeon.